propose merging the healthcare facilities. Now through this, we can add gains through the consolidated efforts of all of the resources pooled together. Realizing the gains from the partnership, we can enhance the services and clinical capabilities. This translates to more efficient patient time through consolidating our efforts, as well as the financial benefits of pooling capital, so we have not only then higher startup, but we can also then utilize economies of scale to lower costs. Looking at the post-merger hospital locations, we're proposing 2 main locations. One in Webster, this would be our largest facility. This facility would need to be expanded. And then our second would be right on the border between Franklin, Hardin, Hamilton, and Wright. Now this second one would be just a general service provider, whereas our location in Webster would be the full service for everything. Now, I want to talk about the merger process and what that's going to look like. We're going to have to redefine the leadership structure. Because there's 5 counties, we have to take that and create an executive hierarchy. The second is ground level integration plan. This is integration at the most basic departmental level across all hospitals. Next is the sustainable cost saving target. We need to establish how we're going to save these costs, what resources we can pull to best utilize our efforts. And finally, a system-oriented culture. This is merging the cultures of the 5 hospitals. This will pose to be a challenge, but once it's successfully completed, it will create the synergy that utilizes the economies of scale. Now we predict this merging timeline to take around 12 to 24 months once all the paperwork is through and the actual merge takes place.
So one of the ways that we're going to create some of that synergy is by employing an enterprise resource planning system to put all of our records in one database, including hospital records, billing records, payroll, everything into one. So the product that we've chosen is Thrive EHR, which is a product of Evident. It's already built for rural healthcare facilities, so we don't think it'll be that difficult to employ. We also believe it's going to keep us technologically up to date and keep us tech savvy compared to our competitors. One of the other things that we really want to try to do is partner with this initiative program that the Iowa Department of Public Health has created. It's already built, and so it's a partnership of local and state governments to advance and modernize public health among 29 different local agencies. The IDPH exchanges information, hosts committee meetings and work groups, and also provides some financial resources to healthcare facilities in Iowa. One of the other things the initiative does is it partners with the University of Iowa to provide a 5-year program for medical students that if they work these 5 years in rural healthcare facilities, it'll provide up to $100,000 of loan forgiveness, which keeps us local and maintains that local control. So one of the things we had to consider was state regulations. So due to state and local regulations, we need to obtain approval from the Department of Public Health for any expenditure over $1.5 million. However, because we're already partnered with them, we already operate in the state as a hospital, we don't really see any obstacles. We actually see it as an advantage. This certificate of need law that Iowa has makes all companies approve this $1.5 million hospital expenditures. So we believe since we're partnered with the state, that it'll actually serve as a benefit for us because we think that they'll approve everything and we're trying to give the best to our customers.
And finally, reviewing our general strategy overview, we understand the importance of maintaining local control, keeping the larger conglomerates out from the market, and this enables us to keep medical health as our premier then healthcare board. We also know that's very important to serve the community, and through partners with Iowa Department of Public Health initiatives, we can then best utilize not only that, but the state resources, and finally, preserve the financial stability through enhancing our clinical capabilities and realizing the gains through efficiency of market and economies of scale. So with all this being said, I would love to welcome our wonderful group up to help answer any of the questions that the Board of Directors may have.
So you talked about changing the leadership structure with an executive hierarchy. Can you tell us more about that?
Sure. So, you know, on there's 5 different counties, and each medical unit will have a different leadership for that department. Well, an important thing going into the merger, pre-merger paperwork and contracts, is that hierarchy needs to be established, because if everyone comes in at once, it could lead to not only a poor merger, but then disgruntled and unhappy company culture coming in with different ideas.
My question builds a bit on Chris's, because your approach of designing new ideas is very rational and oriented towards systems, initiatives, regulations. But one of the biggest obstacles in mergers, whether they will succeed or not, is the management of the people dynamics. So what are your ideas, and the leadership is of course part of the people dynamics, so what are your ideas on how to mitigate this huge risk of the dynamics between people getting out of control?
Yeah. So we designed this plan with the patients actually in mind. Combining the operations, logistics, and systems of all our hospitals are maintaining our goal of local control. So the case study had one main goal, and it seemed like the doctors wanted to keep it local. And by doing so, we protect ourselves against that competition from out of state. And these initiatives, all partnering with the state of Ohio, with Iowa State, in the tuition reimbursement program. We keep it local and keep the jobs in-state. So instead of a large health conglomerate coming in threatening our jobs from in-state employees, we're actually protecting our patients further by strengthening our financial position by combining our resources. So in doing so, we expect a timeline of 12 to 24 months in implementing this plan. And because we're already working with the Department of Public Health in Iowa, we expect to experience no obstacles in the way of achieving these goals.
So what's going to happen with the 3 existing facilities that are going to be closed? People, infrastructure, et cetera?
So the facilities that we have right now are aged, so we will try to sell any kind of equipment to the secondary market or use it in our expansion of our Webster County facility. If we're not able to sell to local clinics, doctors, that's maybe it's a better opportunity for them to move together closer, we will demolish the buildings and sell the land as a cash flow to help fund maybe the expansion and or just generally put into the hospital and improvements.
Thank you so much.
Next up,